Welcome back. You're watching the Power Breakfast Show, and this morning we want to have the conversation on the NHIF rates and to help us understand exactly why they are fighting these new rates. We are joined in studio by Dr. Charles Mukhwaya. He's the Deputy Secretary General, Trade Unions Congress, as well as the Secretary General for all workers at all public universities. And would like you to be part and parcel of this conversation. SMS line is 22422. Any SMSs you have in regards to this conversation, we'd love to hear from you. So get in touch. Sir, thank you so much for joining us this morning. And I think we'll just go straight into it. What are the trade unions opposed to? What is the bone of contention?
Thank you, Gregor. First, before I respond to your question, I would like to make it clear that first, as workers, contributors to this particular fund, we are not opposed to the National Health Insurance Fund idea. After all, we have been contributing and we continue contributing right from its inception, and we would like to support that particular fund simply because we feel that as Kenyans there is need to support our fellow countrymen and women who may not be in a position to get health care, quality health care. But it must be quality health care. However, the current standoff that is making all unions under the umbrella of Trade Unions Congress of Kenya go out is simple. First, the NHIF board and management and the government itself never ever bothered to consult with the contributors and the workers that there is need to review the rates, that these are the rates that we are proposing. What is your view? Are you comfortable with this? Because these rates are being levied on their respective income. If somebody wants to come and deduct any money from your income today, I think it's your right to be given a chance to say yes or no.
Sir, but if it is going to be beneficial to me, and I want to believe that is what happened, the NHIF was able to tell us what exactly they plan to do, then that should not be a problem. If you come and take my money and tell me, Kirigo, this is, I'm taking an extra 500 shillings because I want to improve on the health systems in the country, why should I deny that?
That is very true. That is very true. But you see, that's not the only reason. If you come to me and you want to deduct my money, and it is my money that makes that fund be what it is, I am contributing 100% to that particular fund. You who is coming to ask me that you want to increase the deduction, you contribute zero. The fund belongs to me. The money belongs to me. And therefore, I have the right to decide how I should be able to review, how to run that particular fund, how to manage the money. In this case, the government of Kenya has the audacity to come and deduct workers' money or contributors' money, and yet the government contributes zero. That's the second point of objection. This is a members' club. What business do you have when you are not a member of that club? You have no right, therefore. Sit aside. Let the owners of that particular fund manage it, determine. In fact, we are saying, since the fund belongs to contributors, you and me, right? We should be let to manage that fund. We should be let to appoint the board. We should be left to actually recruit the CEO of that particular fund so that we manage it. Secondly, when you want to review such rates, certain things that you must take into cognizance. For example, these are salaried contributors. If you want to effect any levies on their income, then you must also consider at what rate you want to do that. Because if you come up and say, I'm going to take 300% of your income then you must consider what is the commensurate salary review that this particular employee gets. Okay? What has been going on in the NHIF is that the highest amount has been 320 per month per contributor, right? The rates that we are now opposed to have shot that particular amount to 1,700. That is a clear 400% increase. Who in this country has ever received a salary increase of 400?
But Dr. Muhaya, don't you think it reaches a point where it is about sacrifice? And I go back to my initial point. If it is for what they say they want to do, which is enhance our health systems in the country to make it better, to make it cheaper for you and I, then why should that be a problem?
Thank you. We don't refuse that that's what they want to do. And it's going to be their word against ours. First, what have they done with their 320? For all the years, have you seen anything significant that 320 has been doing to you? They have failed to manage that particular fund when we are only giving them 320 every month per person. Now, and with 320, they have been collecting 8 billion. Right? When they collect the current rates that they have now proposed and gazetted, they are targeting 26 billion. If you have been unable to give quality services with 8 billion, instead you have been involved in corruption, siphoning that money, you are sure that 26 billion this time around it will give you quality health services? That's number one. Number two, we don't deny that there is need to change and improve health services. But first, whose duty is it? Remember at independence, there are key duties that the government promised. Fight illiteracy, ensure that there is no hunger to the Kenyan people, and disease. So when you're talking about health, and in this case we're talking about universal health, which is in the Jubilee government manifesto, it is the duty of the government. You cannot, as a government, want to run a universal health care at the expense, 100% expense of poor workers and contributors. No. No. We deny that. And just before I move out of that, you will get all the monies that you want. Go to Kenyatta National Hospital. As we speak, even right now, there are patients who are lying on the floor. You will go to our hospitals, you have been prescribed to go and get medicine, you will have to go and buy.
Again,
right?
I beg to differ, and I'm speaking from personal experience. You said, what has this 320 shillings done? I have known someone who was admitted at Kenyatta National Hospital, and NHIF was able to clear that bill. Now, my issue with you saying that we can go to Kenyatta now and we'll find patients lying on the ground, is it an issue of this money being squabbled, or is it an issue of people not being educated to know that there is this fund? Because there's also the issue of education, that people don't know that there's this fund that can do ABCD for them.
I highly doubt, Kirigo, that Kenyans who contribute to that fund could be that ignorant that that fund is there and that it can help. Okay? And that's why I said at the beginning that we are not opposed to it. If you want to review and improve on that particular fund by increasing the rates, then first involve the stakeholders and the public adequately. They will be able to advise you that, yes, we would like to have this improved, but at this rate, we feel this rate is okay. That's why I said we're not opposed to it. But you do not just go out and say, because it's a public good, we want to improve this, you just go out and raid people's salaries. That's what we are opposed to. And secondly, the aspect of managing the fund, I said it could be their word against ours. You remember the story of the clinics?
Yes.
You remember how many CEOs have been at the NHIF? It is very clear that NHIF may be used as a conduit to siphon public funds. Get this CEO there, let him do whatever you want him to do for you, remove him, bring another one. And all those who have been there, has there been any investigations carried out? And if found guilty, money recovered? Nothing. The clinic's issue went just like that, and billions of shillings are lost.
So is corruption something you're saying is another reason as to why?
Another reason. Actually, there are very many reasons. That's another reason. That until we are sure that this particular fund now is corruption-free, that the management is going to run that particular fund without political interference, we are not ready. We are not ready to allow members to continue suffering. Then, the other thing, these members who are now forced to contribute to this irregular fund happen also to belong to other similar healthcare schemes, in some instances very superior. Again, when you are coming up with new rates or you want to review and so on and so forth, I think there is need to allow those who are in those superior schemes and who wish to continue in those schemes to have an exemption. You cannot just come up and say everybody must now move. Not in this day and age, under this new constitutional dispensation, that you want to dictate that everybody must follow this rule. That used to be there in the old constitutional order, you know, when the Baba na Mama philosophy was ruling the day. Not in this new dispensation. You've got to allow people the freedom. If I feel that I'm going to get better services this way, I think I need to be allowed to do so. If I feel that NHIF is going to give me better, then I should. Which then brings us to the point that one of the things that we feel needs to be done is that NHIF needs to allow competition so that it is among other healthcare schemes. That way, it will help quality and actually checks and balances. They will find themselves either down there and find themselves, oh, if we must remain in this business, we've got to up our game. But when you want to lock out these others, that all of you, because you know, the workers that we represent are the majority contributors, over 85% of the contributors, and you actually contribute 85% of the total fund comes from the workers that we represent in the entire public service sector. So that's why we're really feeling aggrieved that these are the majority contributors, and nobody in the government ever thought that we can sit down with them and be able to consult, get their views, get the experts also, right? Get all the stakeholders. The Article 232D of the Constitution of Kenya 2010 is very clear that whenever there is going to be policy formulation, you must allow public participation, and particularly in our case, the stakeholders.
Dr. Mukwa, there are those who think you're denying Kenyans a better, you know, a chance for better healthcare services. You know, with this new scheme coming up, there are plans to cover inpatient and outpatient costs as well as ailments such as cancer and dialysis, and there are those who feel that you're trying to settle a personal score because you are not, and not you, but you know, the union trying to settle a personal score, because you are not involved in the whole process. What do you have to say about that?
Thank you. First of all, that is their view, and it's their democratic right to have their view. We cannot deny them to think the way they wish to think. But first of all, we must remember that we are not saying that we are denying. In fact, what TUC Kenya proposed when NHIF took us through the figures, listen to that, they only presented to us after they had already set the figures ready for gazettement, and we started complaining. That's the time they came out to take us through with a view of actually convincing us to rubber stamp, and we said no, we don't operate like that. We should have begun right from the beginning. We said this is not admissible, this is not permissible to our members. But you see, we are professionals. We did not just tell them that this is not permissible. We proposed the way forward so that we help these Kenyans so that they don't say we are denying them. We proposed that instead of going by the rates that they had come up, we said, why don't we go percentage-wise, right? you peg a percentage on workers' basic salary or a contributor's income. And we even proposed 1.5. Now, when we worked out the mathematics, at 1.5% of each contributor's basic salary or income, the amount of money that NHIF was going to collect was more than 16 billion. That means a jump from the 8 or 7.5 billion that they are currently earning.
Yes.
Honestly, then, Kenyans cannot say we are denying them. That was point number one, that we wanted to improve this particular fund, doubling what is currently earning. Two, we also proposed, after carrying out a survey, and even NHIF itself carried out a survey in a wide range of countries to look at the best practices elsewhere, to benchmark ourselves, right? They discovered, and we also discovered, that most of the countries who run a universal health care like what we are proposing to have here, there is contribution coming from the worker, and there is a contribution also coming from the government. If I contribute 1.5%, the government needs to put in another 3%. So if as workers we were proposing to double it, how about if the government also came and gave a similar amount or double the amount that we're giving? Would those Kenyans still saying we are denying them anything? So we proposed and preferred better solutions that we felt would carry everybody along. We are not saying we want to deny anybody. And last, we are not settling any scores. We want better management, governance of whatever public funds that we are having and the facilities and institutions that we are setting up through this kind of contribution. We do not want to repeat what has been in the past. No. Once beaten, twice shy. We want these things done. So that's why we said, don't go in that direction. How about this one? And they agreed. They said, you guys are coming up with very good ideas. These are the ideas that we now want to go and think through. We consult further, and we will not gazette these proposed rates until we are finalized with.
We discuss.
Yes. We came back from that particular retreat in Naivasha with them, and within 1 week, instead of calling for meetings, they gazetted. So again, you are seeing bad faith. I cannot sit down with you to negotiate with you when you're negotiating in bad faith. But we gave ourselves up to the spirit of dialogue. We said, nonetheless, let's keep talking to these guys. So
what happened on Monday when you went in for your meeting and, came out late in the evening very upset and saying, we're calling for a strike, midnight?
Kirigo, I can assure you that in the spirit of dialogue that we strongly believe in, as professionals again, we gave out a strike notice and served it on the Minister for Labor on 19th of June 2015. And we said this is a 7-day strike notice, and at the expiry of it, if the government will not have come forward, very frustrated at that point, because we don't like strikes. We go there as a last resort. And on paper it was 7 days, but on the ground it was more than 7 days. We said by 30th June 2015, midnight, coming to 1st of July, if there will be nothing, then we will now consider going on strike. And the Minister for Labor did the right thing. She invoked the provisions within Article 70 of the Labor Relations Act to invite the parties, ourselves, and the government side, plus of course the NHIF side, on the table to listen to the contestations that were being raised with a view of helping these parties come to an amicable solution. So the first meeting we held was on Monday, and we candidly tabled our memorandum, which memorandum has all the observations and the points of dispute and everything.
The proposals as well.
And the proposals as well. What we think needs to be done and so on and so forth. And I can assure you, on that particular day, everybody agreed and said, yes, I think this is
this is the way forward.
This is the way forward. Of course, at that time, our demand as TUC Kenya was that revoke the gazette notice. And the government side was saying, fine. They are also demanding revoke the strike notice. At the point, we said, yes, if we are going to engage on this table, then we must remove the gun from each other's head. Right? So that was the point. But then we had the AG to give us the legal advice. Is it possible to revoke this particular gazette notice? And if it is done, what are the implications, repercussions?
Repercussions, yeah.
And we were advised that it may not be possible to revoke it now. One, that if you revoke it now, you must have an immediate replacement. Okay? So we said, fine. What do we do? The advisor said, it is possible to suspend the implementation of those rates.
Which is what?
Right?
Yes.
So the other part said, yes, they are willing to suspend. So we also said, okay, if you are willing to suspend, we are also willing to consider suspending our strike notice, so that then we allow ourselves to engage.
More room for engagement.
Yes,
more room for
2
conversation.
or 3 weeks, yes.
Yes.
To now come up with a mutually agreed proposal, which then can be used to replace when the actual revocation of the gazette notice is done.
Yes.
Right? And so, but then they say no. If then that is the case, which is they are very good proposals, both parties. We said, now that it's late in the night, why don't we adjourn and do further consultations?
Yes.
Then we reconvene
the
following day to finalize.
Yes.
In fact, at that point, it was like the AG's office was to do a draft of the proposals. What would be the tentative agreement, so to speak. So that when we come back the following day, then the parties are able to peruse, and if they are agreeing, they append a signature, and that's it. We came back the following day. The goalposts had shifted from the government side. We expected that we would begin the second day from where we had left.
You had left the previous day, but it didn't happen.
Unfortunately, it didn't happen. On the second day, they began from where they were.
Backtracking.
Yeah, on the first day at the beginning, the first day's engagement. Even what had been proposed to us, that they are willing, they still have the money with them, they have not spent even a cent, and they are willing to refund. The second day, now that was not there. Money is not there. They are not able to refund. They have already disbursed money. We started wondering, was the money disbursed at night? So we were able to see bad faith. We were able to see insincerity. We were able to see people who are not ready to make commitments of their own statements. We felt that we were being taken around in circles. Let
me ask you a question here, Dr. Daniel asks a very valid question. KOTU has a representative. When the suggestion to raise the rates were done, where was your representative?
Thank you. One of the reasons as to why we are contesting this is that we do not have representation. Remember, 85% or more of the total amount that fund gets every month comes from our members. We are not represented as TUC Kenya. We are not. At the time when the NHIF board and management were consulting, probably they consulted KOTU, because KOTU has a representative there.
Yes.
Right. So we were not there.
You were not there?
Yes, we were not there. Remember, we came into being fairly recently. But even when these current rates that we are now protesting were coming up, were already in existence. NHIF never saw the need to consult us. In fact, they felt, according to their own chairman, the NHIF chair, that having consulted KOTU and the FKE, they had consulted all the stakeholders. No. In Kenya now we have 2 labor centers.
Yes.
KOTU and the Trade Unions Congress of Kenya. So if you are consulting with KOTU, don't assume
that you have consulted
all the workers.
Okay. No. Okay. Let me read a few SMSs here. This Kutere in Eldoret. Kiriko, what NHIF is, it's a cash cow, because already workers had already lost their medical allowance, are paying 320, then this huge deduction, yet their services are poor. This is immoral. Then someone else says the government is the biggest employer. It loses when workers are sick and cannot go to hospital. The NHIF helps people when they go to hospital, but it is not adequate. Let Sosione and his group stop cheap politics. They are not talking for workers, they are politicking for their own goods, increase the rates. For me, for them to increase NHIF is not about good medication. They're looking for money. Look at the list of health centers given by them. They want more money in their pockets. This is Hezekiah here in Nairobi. We should maintain the current computed rates but make contributions voluntary. It's foolish to go on strike because of personal health issues. Either contribute or be prepared to personally meet own medical bills. So we are seeing a group that is divided. There are those who are for and those who, are totally against it. And what I'd want to know, is there room for dialogue? Is there still room for dialogue with the government, or are we done with this conversation and we're moving on to the next thing?
Kirigo, I will tell you without any fear of contradiction that we gave the government of this country ample room to dialogue right from December last year, when we were first invited by the NHIF. Again, not to consult with us, because they had already formulated those figures to take us through. We started telling the government and the NHIF that you have erred on this. You did not involve us. And then we went again to Naivasha for a retreat with them. We are still dialoguing with them. As late as 2nd June 2015, we are still dialoguing with them. But still, they were only merely taking us through those threats to make us convince them. When we gave out our strike notice, we were still giving the government the chance until 30th of June, 12 midnight. We gave them the chance to actually come forward. And I want to thank the acting Cabinet Secretary for Labour. She is a bold lady. She took it by the bull by its horns and called the parties, come. We want you guys to dialogue here until you get to an agreement. But the team that was sent by the government of Kenya to come and dialogue with us let the government down. First, they are not free. You actually see a hidden hand behind. They are not themselves. And so when we were unable to agree, we told them now the door for further dialogue is, we cannot dialogue forever. We cannot dialogue forever. Right from last year all through, up to now, we are dialoguing and there's no end.
So that door is closed?
That door is closed.
That door is closed?
Yes.
No more room for dialogue? So
in
now
fact, whatever proposals we had given them, we have now taken them back.
So what does that mean? You called for a strike. We have seen, different units go on strike. The dock service in Mombasa has gone on strike. I mean, is this the answer to our problems? Because already we're feeling the effect of the strike in Mombasa. We are having goods coming, cannot be cleared. And Ugandan businessmen have said, if this strike does not end today, or continues past today, the Kenyan government will have to pay.
I agree.
Labor fees. So are you seeing what is going on? I mean, at one point, I understand where you're coming from, but then you also need to understand that a country needs to, move on.
Thank you. First, it is unfortunate that that is what is happening. Our country is strategic in this region. It is serving the entire hinterland in the East and Central Africa, and the goods to those destinations got to pass through our port, and so on and so forth. And of course, the other public services within the country are going to be affected by this particular strike. We feel for them. But you see, for a union to get to the point where it's calling out its workers, it is actually a point of frustration. In fact, we are appealing that the best way we can reintroduce dialogue, we are appealing to the president himself to now come forward. Let him not send us those men and women who are letting him down, who some of them are not even able to express themselves. Let him intervene. We will dialogue. But the team that must dialogue must be a team that is coming to dialogue, not to dictate. Because when you are told, like what you're being told by that team, this is a government policy, we cannot talk about it. A government policy to steal from workers without prior notification, that cannot be a policy of a government. I don't think so. When you talk of universal health care, you don't know that that is a government's duty, that the government therefore needs to be actively involved, and yet the government does not to send any single cent. So what we are saying is that yes, we feel the pain of what is happening at the port and elsewhere. But I think perhaps that is the best language that will make those in the government to come forward and say, no, 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 ladies and gentlemen, let us
sit down
and talk. And we are not averse to that. We are not. Anytime, anywhere, we are ready. But there must be proactive discussants, proactive people who are coming to dialogue, not people who are coming to take us in musical chairs and state government policy, which is not government policy, and say this is, we have no option, we must go by it. Not in this current...
Not in this day and age.
No.
Let's go back to something you said, and I want you to make it clear for us, the issue of public participation. How would you ensure that happens? Because again, we hear, you know, a certain people were selected or certain people presented themselves, and these are reviews, or rather these are views from people we sat down with. How would you ensure that everyone is represented in such a scenario?
Maybe I'm not the best person to answer that question.
But you asked for public participation.
Yes. In our view, when we're talking about public participation, is first, they will have to ensure that the people who are going to receive these services are consulted. People who are going to fund these particular services as key stakeholders are consulted right from the beginning. Is there a need, for example, for us to review this rates? Yes or no?
Yes.
If the answer is yes, then we move to the next stage. For example, how much would you think
it would
be best? It works, right? You know, and then they will give their views. There would be health providers, you know, are also key stakeholders. They need to be involved. So for us, where we are sitting, we are only talking on behalf of our members, who are the contributors, not everybody. To ensure that everybody participates is a function of
a totally different function.
Yes.
But you as this organization will ensure that the people under you...
And of course, this is the reason why trade unions are allowed to operate. Because you cannot sit down and consult everybody.
True.
Right?
True.
But when you have a trade union or a labor center like ours, it organizes all those unions and their respective members to one. So that instead of talking to individual members who are hundreds, thousands of people, you have one body that you can be able to consult and say.
And the reason I'm asking is because, you know, when you talk of public participation, the question will be, but Dr. Mkhwaya never asked me that question, never asked me, you know, my contribution personally. So I'm glad that you were able to come out and say, listen, it is not on an individual basis. We come as a group together and we are able to make those decisions. Well, what's your final word on this whole issue? Are we going to see the end of the strike soon? What needs to happen next? Because the country needs to move on, Dr.
Thank you, Karigo. Indeed, the country needs to move on. Our Kenyan brothers and sisters need to receive quality health care. And remember, when you're talking about quality health care, again, it's the responsibility of the government to even ensure that their facilities, their drugs, their qualified personnel, remember, doctors are not running out from our hospitals, and I'm being told increase by 400%, and yet those hospitals don't have doctors. Qualified nurses are running away to other countries. So we actually need to ensure that our brothers and sisters receive quality health care. And therefore, there is need for us to, you know, look at these NHIF rates that were last reviewed in 1989. That is a point that we cannot, you know, gainsay about it. But to come to your question, what needs to be done? Actually, the ball is right at the doorstep of the president and his government. If they were, for example, to say, you guys in TUC, the way the cabinet secretary came forward and said, you know, I don't know what you guys are complaining about. Can you come and let me know? Let me socialize me in these issues so that I understand and see how we can come.
What's going on?
We are saying the ball is at the doorstep of the president. If you want this matter and Kenya not to be blamed by neighboring countries for holding their goods and so on and so forth services, then he needs to take a bold step and step forward and say, hey, guys, what is this that is happening? Can we, let me listen, because maybe he's not being given a proper advice. And we saw it in that team, that even the cabinet secretary who are there, cabinet secretaries who are there, did not have any idea about what was happening until we troubled our memorandum and said, yeah, I think you guys are making sense.
Making sense.
Yes. So the whole thing is at the doorstep of the government. And for us, we are ready. anytime we can be able to sit down.
All right, Dr. Mkwaya, thank you so much for coming in this morning and helping us understand this conversation. You've made it a bit clearer for most of us. And like Dr. Mkwaya said, in his words, the ball is on the government's door. They are willing to listen,
right.
But it is now the government that is to look for them.
Right.
Thank you so much for that opportunity. Now, don't go to